So who's a good candidate for this and who is not? And what are some signs that maybe you're pushing it a little too far, too fast?
So in my book, everyone's a candidate for it. There might be cases where I say we need to wait until X, Y, or Z is done for us to do this. Like people who are on active thyroid medications, treatments, that's a longer story, right? It has to be individualized. But then eventually I'll put everyone on it because of the profound benefits that we see for people. And then it's a question of, okay, are you tolerating it well? And again, the symptoms I tend to see when people are going too fast at too high of a dose are palpitations, anxiety, insomnia or poor sleep, acne, and they can also sometimes have brain fog and fatigue because we think of these halides coming out.
Here's a question for you. Should we take
I
iodine in the
take,
morning, one dose, or
yeah,
small doses throughout the day?
I take iodine in one dose a day. So I would do 50 milligrams at a time or 25. And I did work up to that. I took it usually take it with food. You don't want to take this with vitamin C because the vitamin C will change the chemical structure of some of the iodine. That's not a bad thing. It's not like it's poisonous. But you'll notice if you drop Lugol's into, say, vitamin C powder or a vitamin C solution, the Lugol's color will immediately change. So
Let's talk about some of the other applications for iodine. For example, I will use it on like when my feet were really in a bad place. I would use it on my feet. I started using it on my toenails. I think it has, you can use it to purify water, particularly. So there's what other applications are there for iodine?
some of them I won't get into here because they would really require more time to unpack. And frankly, I'm a little bit uncomfortable with just telling people without really having time to make sure one-on-one that they understood it. Because iodine's fat soluble, you can deliver it to the body so fast that you could, at least theoretically, overwhelm the system. But that being said, you'll find stories of people rubbing it on fibrocystic breast disease and getting profound relief. You'll find stories of women using it intravaginally. It's very well absorbed through the vaginal mucosa. They'll do that to treat fibrocystic breast disease because it will go straight from the vaginal mucosa into the bloodstream and then be carried to the breast tissue. And you can use it topically anywhere, but you have to be aware that if you're using something like Lugol's or any iodine solution, it's going to evaporate so quickly that the vast majority is evaporated and not absorbed. There's a iodine absorption test that people will recommend sometimes where you put iodine on the skin and then you measure how long it takes to disappear. That's supposed to tell you how deficient you are. 88% of that is just evaporating. So we don't use that in the practice to judge deficiency. Dr. Brownstein has been very clear that this does not have anything to do with total body levels. And those are really the top ways to use iodine, either internally, the way we've just talked about for most of this webinar, or using it topically